Well, there is no such thing as a slow day at the David Lawrence Centers for Behavioral Health in Naples. It says it's seeing more kids and adults than ever in need of immediate help. And for a long time, they've been running out of beds. In today's Your Healthy Family, we're looking into why and what you can do to help. Over the last several years, the David Lawrence Centers for Behavioral Health in Naples has seen a dramatic increase in Baker Act admissions for adults and kids.
We have 30 licensed beds, and we've actually had days where we've had in the mid-40s, high 40s as far as need and demand.
President and CEO of the David Lawrence Centers, Scott Burgess, says one day they had 56 clients in need of a crisis bed. And when someone comes in need of crisis services, they deliver no matter what.
We've got some rollout beds that we can accommodate. We've actually had to move some of our staff off this campus, administrative staff, in order to free up more clinical space.
So what's behind this need for mental health care?
We were really dealing with two major epidemics in our country and our community before the pandemic.
First, the suicide epidemic.
Suicide is now the second leading cause of death for kids in our country.
Then, the opioid epidemic.
We lost 100,000 Americans last year in the last 12 months to the opioid overdose. And to put that in context, we lose about 25,000 Americans to motor vehicle accidents across our country.
Add on top of that the isolation, depression, and anxiety of the COVID-19 pandemic, there's a dramatic rise in the need for mental health care. In fact, the David Lawrence Centers says 1 in 5 people in Naples has a serious mental health problem. Bottom line, they need more crisis beds, so they're expanding.
We're in the process of building out the 15 beds right now.
But here's the thing.
In order for us to be able to add these 15 beds onto campus with the construction, we know it's going to cost about $500,000.
Burgess says Florida is one of the lowest funded states in the country for mental health and addiction services and has one of the highest uninsured populations.
We're here to help treat everybody in the community, regardless of having insurance, regardless of income level. So in order to maintain that commitment, we really do need to rely on support from our community.
He says donations will go toward construction costs, hiring more doctors, nurses, behavioral health technicians, counselors, and discharge planners to make sure they can care for you or your loved one in the biggest time of need.
We need to treat these as what they are, which are potentially life-threatening healthcare conditions. If they're not attended to and people don't have access to them, we know that there are dire consequences.
It really is so important. I'm Lisa Greenberg with today's Your Healthy Family. And for more information on services, upcoming events, and fundraisers, or how to donate, just head to fox4now.com/yourhealthyfamily and click on this story.